Well, good afternoon. It's great to be back at the Villages. I want to thank the following folks for joining us here today. Gary Lester, Vice President of the Villages for Community Relations. I want to thank him and the Villages for all they've done over these many months to really protect their residents. Dr. Jeff Lowenkron, Medical Director of Villages Health. Dr. Robert Riley, Internal Medicine for Villages Health. Of course, we have Jared Moskowitz, the Director of the Florida Division of Emergency Management, and then Dr. Rita Smith from the Florida Department of Health. I announced last week that Florida was going to be receiving large shipments of a new rapid test done by Abbott Laboratories called the Binex Now test. It's a test that delivers results in 15 minutes or less. Does not require the results to be run through a lab or any type of a machine, and we wanted to make sure that as soon as we got those, that we were putting those out in the parts of Florida that it would make the most use. And so today we're here to announce how we're going to do that. But before we do that, we're going to do a demonstration on the test. So I've got Jonas from my staff. If he tests positive, he can't fly back to Tallahassee with us, so hopefully he's good. But it's a very simple test to administer, and like each box will have individual packets that have these in it. It has the reagent, which you'll see is being administered. So the reagent is applied. They do two, and these are not the real deep like almost hit your brain type. These are just in the nostrils, both nostrils. You'll see they'll put it in here, close it, and then you get the result. So it's a really interesting technology that they're doing. All right, so we wait, and normally if it's positive, it happens relatively quickly. So we'll read the results there in a few minutes. But when we were given the ability to do these tests, we wanted to really focus it on our senior citizens, because as we know, there's a radical difference in the effects of COVID-19 based on age group. Underlying health conditions a big factor too, but if you look above 70, the survival rate is about 94.5%. If you look at under 50, it's 99.9%. And so we really believe focusing protections on the folks who are most vulnerable to disease is our top priority. And so when we got the initial allotment, and we're going to be getting 400,000+ a week that we're going to continue to be distributing, we wanted to focus on two main areas as it relates to senior citizens. One, continue what we've been doing with long-term care facilities and nursing homes. The federal government has actually sent the Binex Now test directly to about 800 nursing homes throughout the state of Florida. We have over 4,000 total long-term care facilities, and so we are sending these tests to the remaining roughly 3,200 long-term care facilities. And of course, that could be used to continue with the screening of the staff, which if you do regularly, you may be able to pick up an infection and prevent it from spreading. But also, now that we have visitation back, we have not required tests in order to have visitation, because our view is you can mitigate and you have the PPE, and to say someone gets a test and then they get their results back 48 hours later, well, that may be accurate from when they took the test, but we don't know what's happened in the 48 hours. So we said, let's mitigate, focus on things like PPE, doing some of the basic things. But even though it's not required, now that you have a 15-minute test, this can also help visitation in our long-term care facilities. And so they'll have the ability to do that as they see fit. And again, using this new technology in a way that is protecting our most vulnerable and saving lives is really the key. But we also understood, as important as our long-term care facility residents are, because if you look, not just the age, but if you look at 70+ in those facilities are much higher risk than 70+ who would be living independently and not need that type of assistance. There's a big difference there, but we also wanted to help the broader senior community. And so we went and are looking at all the different senior communities throughout Florida, like the Villages, and we're sending these two facilities like that. So you have the Villages, you have places like Sun City Center in the Tampa Bay area, Century Village, all those complexes in southern Florida, places like On Top of the World in Ocala, and others. We believe that this will help give them more tools to be able to protect the residents who live there. So we're excited about this. We think it's something that can really make a difference. So of the 400,000 tests for this week, and we're going to be getting these every week, we have 100,000 for long-term care facilities and 180,000 for all these senior communities. Again, that's just 1 week's worth of stuff. But we also know there are other communities, senior communities, that may want these. We have some that express an interest that we were able to identify, but we think that there's probably many more. And so if you do not have, aren't on the agenda to get one of these by next now, but you'd like it, you can actually send an email to Rapid Test for Seniors. Again, that's Rapid Test for Seniors at em.myflorida.com. Again, Rapid Test for Seniors at em.myflorida.com. You'll get an automatic reply that leads you to a survey where you can fill out your community's information, including a point of contact. And the way we view these as important for senior communities, one, it can help provide an ability to get quick test results if you're doing some type of event amongst the seniors, and maybe they want to have that option. When people come and visit their family, you'd have an option to be able to have a quick test result. And again, the tests aren't the end-all, be-all. Doing the basic mitigation, the sanitation, staying home if you're sick, all that's still important. But it's an additional tool that can not only help identify virus and obviously keep it out of some of these communities, but also affirmatively allow seniors to be able to live and enjoy life and have the confidence that they can do that. So we think it's really, really important. We also have, in terms of the initial allotment, we have 60,000 tests that are going to be sent to our school districts throughout the state of Florida. And this will be for any student or teacher who develops symptoms and needs to be tested. What we found is, I think most are doing a good job of, if a student's sick, they're staying home. We do have all this on the internet now, so you still can keep up with your schoolwork. But if a student is either sent to school that's sick or becomes sick in school, you take the student out, isolate them, but then if you can get a 15-minute test and you get the negative, then you don't have to worry about isolating some of these other students. And I think what we found is there have been students that have been forced to isolate who are healthy. And I think healthy quarantining is not effective. It's not something that we want to see done on a large scale. So these tests really give you the ability to take that off the table. If you have somebody that's symptomatic, but is negative, then clearly you got to continue going on. So we want to keep as many students in the classroom as we can. We're also sending 60,000 to some of the sites that the state helps run, some of the test sites, like at the Orange County Convention Center, and those will be in operation sometime this week. So we've had some rapid testing going on already at some of these sites. Now every site will have 15-minute rapid testing. So we think that that's good. People, remember, when this all started, well, first of all, when it all started in February, I mean, the CDC actually took all the tests back. So we were in a situation, it's very hard to even get anybody tested. Then you had to send it to Atlanta. It took 5 days to get the results. We beefed up the testing capacity. When we saw the spike over the summer, you had huge numbers of people getting tested. A lot of these, this was not just in Florida, this was all over the country, but particularly the South. So you saw huge backlogs in some of these commercial labs. So you have some people that were getting tested, they get their results back a week later. Well, that's not really helpful in terms of isolating or knowing what's happening. And so I think this technology is really, really good. I think it'll be able, you could get your result, you could just wait and get your result before you even leave. And I think that that's good. The rapid that we have had at some of these sites have been very popular, and so this will spread it out. It's also going to save the state a lot of money. I mean, these PCR tests cost $100 a pop. Granted, we do get some reimbursement. We can use CARES Act dollars for it, but we're getting these rapid tests for free Federal government has given to us for free. So basically the cost of the state is whatever it takes to administer the sites, and then you're able to go from there. So there'll be 60,000 there. So the total, 180,000 for our senior communities like the villages, 100,000 for our long-term care facilities, 60,000 for school districts, and 60,000 for state testing sites. And this is just the first week. We're going to continue to be getting these as we go. And so that's why it's important, if you do have a senior community, if you're in a community and you would like your community to have this, just have them do the rapid test for seniors at em.myflorida.com, and we look forward to working with folks on this. So this is, I think, an important step in continuing to really do all we can to focus protection on our most vulnerable residents. And I think that the villages have shown that you have to have a sustainable approach to this. You can't just say that people can never leave their house. That's not viable. That causes a lot of problems as well. And so what the villages have done is, they've put out guidance. They've had a lot of things going, like golf and all these other things. I think Gary said they just did one of their outdoor events. So it was the first time yesterday that they did that. Now they're still going slower on some of the big indoor events, which makes a lot of sense. So they've really empowered their residents, provided the guidance, kept away from certain things that may be riskier, but provided a lot of avenues. And I think this test will help with seniors to be able to continue to do a lot of the things that they want to do. And we're mindful of how the isolation has played on so many. One of the really tragic, I think, results of this is when you looked at some of the nursing homes and the long-term care facilities. Yeah, you don't want a lot of people going in and bringing COVID. Obviously, that's life-threatening in that demographic. At the same time, you need to have the family connection. You need people to be able to be with their loved ones. And so by allowing the visitation, that's really been relieved a lot of anguish. It's alleviated a lot of loneliness for a lot of families throughout the state of Florida. And I would note that once we did that, and I'm not saying it's because of this, but you've seen a big decline in the number of positive cases at our long-term care facilities since the visitation went back. I think part of that is just because the prevalence has gone down throughout the region generally, but it just goes to show that you got to do this in a holistic way. And I think these tests are going to be able to help those folks as well continue to live a good life. Do we have a result now? Negative. All right. So he gets to come back on the plane tomorrow. But it really is that simple. I think that they will be able to do where if someone just wants to get swabbed and then leave, they will then get the result, I think, within the hour, which will be really good going forward. So I want to thank Jared Moskowitz for making this happen very quickly. They're already here. So the villages has these. These other areas are getting them. If they haven't gotten them already, they'll be getting them today. And then our test sites hopefully will be up and running with these very, very soon. So Jared, you want to come up and say a few things?
Governor, thank you. First, let me thank the folks behind me at the villages and everyone that we've worked with since early March. Obviously the villages is someplace we've been to time and time again since the pandemic began, but the folks here have really done a tremendous job. This was a place, obviously, that we were extremely worried about, and because of the hard work of the folks behind me and many more here to make sure that the folks here could be safe and that they would have the resources that they need. And so, that's a real success story among what's been going on with the pandemic. So, from day one, the division has been extremely aggressive to make sure that the residents of the state of Florida have all the resources they need under the governor's direction. And so when there were no COVID tests in the very beginning of this, we made sure that we got COVID tests on the open market. When there were no swabs then available to collect the samples, we made sure that we were able to buy swabs from around the world and bring them here to the state of Florida so that we could do testing. At over the 60 state-supported testing sites, we've done now 1.7 million tests, and we've done more testing per capita than almost any other state in the country. When we saw the spike happening in nursing homes under the governor's direction, we instituted a 90-day testing program and conducted 1.2 million tests in our nursing homes and ALFs. It was the largest testing logistics mission in the country, and 4,000 facilities happening simultaneously. When hospitals needed help, the division helped move personnel, medical personnel, doctors, nurses, respiratory therapists into those hospitals, over 2,500 medical personnel, so that not only for personnel that they needed, but also to give doctors and nurses that have been working this pandemic since the beginning a little bit of a rest. And so that proved to be a successful model. We have distributed 70 million masks, 22 million gloves, 7 million gowns, 2 million face shields out to the public sector, to the private sector. Just recently, we made sure that Secretary of State's offices, the Supervisor of Elections offices had PPE for the upcoming election. And for school reopening, we've sent out 9 million cloth masks, adult and children masks, to all of the school boards around the state so that they could have the PPE for school opening. We also wanted to make sure that local governments had the resources, the financial resources that they needed. COVID's just not happening in a vacuum. We've had other disasters that have happened here, and a lot of local governments have dollars that they're waiting for reimbursement. So since January of 2019, the division has sent out $3 billion in reimbursement, $750 million of that since COVID-19 happened. And we're ready for the vaccine. Because we didn't want to be competing against everybody like we did with PPE in early March, we've already gone out and purchased 5 million syringes, 5 million Band-Aids, 5 million alcohol swabs. Those are in the warehouse ready to go. And so, we'll make sure that these tests, these new Binax Now tests get out because of the ease of the packaging and the light of weight. A lot of this is literally going to go through UPS, FedEx. It's going to go through the mail, which is going to make this very easy to keep the ongoing distribution flowing. So we'll watch to see, obviously, what the burn rates are, and we'll make sure that we're keeping up with that. And so, as the governor announced, for those senior centers, send that email in. We'll make sure that we collect the data. We'll make sure that we're responsive. People can always reach me if they feel like they're not getting the attention they need. But we want to make sure that these tests get out and they get used, and we'll make sure that that happens. And by the end of the week, I expect to see all of these tests at our testing sites now, all our state testing sites. So folks will be able to get a rapid test, which will dramatically increase everybody's wherewithal and to take the requisite steps they need to take in the event they have a positive. Governor, thank you.
And we're also, we have had, as I mentioned, some of the other rapid tests that have been going, but that's things that we had to pay for, which we were willing to do. We're going to continue using that. I think the contract is another, week or two. And then we'll be able to totally phase that out because we already have these here. So we'll save money on not having to send to the labs. But then even the rapid tests, we'll be able to displace what we're doing with this. So you're talking about, with all the testing, you're talking about probably tens of millions. Would you say tens of millions of dollars in savings for the state of Florida? So each month. And so, because these are $100 a pop, these labs have made a lot of money over the last 6 months. And so that'll be really, really good. So really want to thank the Trump administration for working hard on this and getting this out. I think that this will be very, very significant. Also, Jared and I, we are monitoring this hurricane in the Gulf of Mexico. Now, if you're in Northwest Florida, we want you to continue to take a look at it. The rest of Florida looks like it's not going to be any type of threat. It's been moving further west, and so if that track holds, then you'd probably see modest impacts in places like Pensacola. But as we saw just a few weeks ago with Sally, there was wobbles to the east, and so just keep an eye on it. Listen to your folks on the local level and heed instructions. But it's not something right now. We think it's going to be a really significant hurricane, but it looks like it's even tracking west of New Orleans. But we'll see. I think in the next 24 hours will be important to see whether that track solidifies or not. We take some questions.
Governor, you mentioned that the village is starting to reopen its town square. We've seen some images in the local paper that no masks are being requested. Not many people in our most vulnerable here in the village were wearing masks last night. What message would you send to the population here who you just said were the most vulnerable?
Well, look, I think that taking the precautions, I think makes a lot of sense. And so whether it's masks, whether it's continuing to wash hands, which really makes a difference, and then if you're sick, just stay home. If there's an event here and you're sick, stay home, and now you'll be able to go get a test. You'll know right away. So those basic things, I think, really can work well.
going.
How
Yes.
about voter registrations just crashed last night, and Commissioner Nikki Fried took to Twitter calling on the governor to extend the registration deadline to at least 24 hours?
Well, so what the Secretary of State did, it's just been announced, is that they are opening the window from noon to 7 today. So basically, similar time frame when you started to experience problems. Hadn't had any problems, started to have it last night, so they're doing that. They're also requesting through the Highway Safety Motor Vehicle, the DMVs remain open till 7, so you can do it in person. The Secretary of State is requiring supervisors of elections offices to remain open until 7 o'clock. And then we're also asking the tax collectors to stay open until 7 o'clock. So be able to do on the website, hopefully. I think they're investigating some of the issues of kind of what led to it, but it was an inordinate amount of traffic. So that'll be live, but you'll also have ability to do this, and you also will be able to postmark a registration today. That will be accepted if it's postmarked today. So providing as many opportunities as possible, and also providing the similar time frame from when we were experiencing difficulties yesterday.
But you don't need 24 hours.
No, I think that it was about a 7-hour. Started to see problems around 5 o'clock. Obviously, the deadline was midnight, so this is a similar thing. And also, just we really think it's important that that there also be live people that can help, and that it's not just internet or nothing. Because I mean, you can have the best site in the world. Sometimes there's hiccups on it, and so this way, people, even when they get off from work, they're going to have till 7 o'clock where they could be able to go do that.
And it's working now, everything's working.
Well, it's working now, but as you know, I mean, if 500,000 people descend at the same time, I mean, it creates a bottleneck, and that's what we see. So there were people who would go, it couldn't get through, and then they would try again, and they would get through, but it obviously wasn't smooth because you had so much traffic. So hopefully it'll be fine, but we also have these other ones, and that's why, when I said we want to have be able to go in person, particularly, to have things like supervisors open until 7, I think that gives people who had problems yesterday an ability to go in and do it that way, if that's the way that works for them.
And speaking of voting, yesterday I was in Lake County, and some of the folks who were casting their ballots didn't even trust the ballot box outside. They wanted to hand deliver it. Many told me that they were worried about our local postal service because of messages coming from the top down. How confident are you in our postal service moving forward with this election? No,
look, Florida, we don't. So there's a lot of confusion about some of the stuff with voting. We have what's called, we call it vote by mail, but it's basically absentee voting. So if you want to go and ask for a ballot, they will send you a ballot. You request it, they send it to you. We know who requested it. We have a record of that. We know where we're sending it. And then you send it back, and it's safe. Obviously, you got to sign it. Your signature's got to match, because we don't want other people voting for you. And I think that that's proven to be effective. I think the fear that some voters have is, you see, like I've seen these things out of like D.C. They're sending it to these homes, and you have people that haven't lived there for 20 years. You have people that are dead that are getting ballots sent. It's just a mass mailing of ballots regardless of whether it's requested. That, I think, is not a good way, but that is not what's happening in Florida. That does, I think, open up the possibility of fraud. But when you're specifically requesting it, they're writing your name on it, they're sending it back to you, you should be in good shape. And I think that it's worked well here. We obviously are going to see more mail voting than we have in the past. And I've told Laura Lee to make sure all those folks are ready to handle that and process that. Fortunately, in Florida, we're allowed to process the ballots as they come in once the window starts. There's some of these states, they're not allowed to even start that until the polls close. Well, that's going to take forever to be able to count that. So if we had to wait, man, we'd have millions of ballots that would just be sitting there. So all those ballots will be counted, will be either verified and counted by the time the polls close, except for the ones that come in at the very end. And so I think that will make it much smoother. So yeah, people should have confidence. Send in the ballot back. We're not just sending out ballots to everybody under the sun. We're not sending them to dead people. And actually, I think you saw, I think in Manatee County, you had a guy that requested a ballot for a dead, maybe it was a spouse or someone in his family, and they caught him. And just people should know that the integrity of this is important. If you engage in that type of business, funny business, you will be held accountable. And so we do the vote by mail for a reason, because it is convenient for people. We've got a lot of folks who split time between Florida and other places. And then now with coronavirus, I personally think going into a polling place, it's totally safe, but some may not feel comfortable, they can do it. And that's what it's there for. It's not for people to try to game the system.
Governor, back to the rapid test. You speak like this is a game changer for Florida here on development with residents. Can you speak to your confidence in the accuracy of these, just to give that reassurance? People may think taking the labs out of the equation may be concerning, and it seems you have high confidence in
So here's the thing with all this. None of these tests are 100%. It's just the reality. None of it's foolproof. What I think this test will do is if you have live virus, it will pick it up. And if you're positive on this, then you can know that not only have you been infected, but you're actually carrying the virus at that point. Some of these lab-based PCR tests, as we've seen, they can pick up the dead viral fragments for weeks, sometimes months after the infection. Well, that's a problem, because then you may have been infected 2 months ago, you pop positive, and then you got to quarantine for 2 weeks. So I don't think this test is going to pick up those dead viral fragments. So it's a little less sensitive than the labs. But for me, I think some of those lab tests have been too sensitive. I think they've overshot some of these. And look, I mean, at the end of the day, in and of itself, is that necessarily a bad thing? No, but if it's attached to quarantining somebody who's not infectious, that's a big problem. And I think what the research has shown is once you get infected, it kind of spikes up with the infectiousness, and then it really trails off. But you're not infectious for 14 days. You're really infectious for a much smaller window, maybe 5 or 7 days. But certainly once you get into 10 days, and especially if you don't have symptoms, the chance of you shedding that and infecting somebody else declines dramatically. So it's just a different type of test. And I think what happens is when you've had an outbreak like you've seen throughout the South, and we're on the back end of when we had high test numbers, I guarantee you, of the PCR results we're getting now, I guarantee you probably 10–15% are dead virus that people are picking up. So I think this one is good because if you pop positive, I think you have a good sense that you are actually positive and you actually should isolate, which is right. If you're infectious, we want you to be isolating. We certainly don't want you to be having close contact with people. And the mask is not enough if you're infectious. I mean, it may stop some of it, but I think if you're infectious, you need to stay home. Don't say, oh, well, I can still do whatever as long as I have the mask on, because it's not 100%. So I think that you just have to understand none of these are foolproof. I think people have been pointing out at the White House, which is a different test than this, how everyone gets tested every day. Anyone that's going to be around the president is tested. I've been tested I don't know how many times. Every time I'm around them, they make me test. And it kind of gets annoying, but I mean, they've really been very diligent on it, and yet you still had virus get in. So none of this is 100%. This doesn't displace doing some of the basic mitigation. This doesn't mean you shouldn't be worrying about your sanitation and washing your hands. It doesn't mean that people don't need to stay home. It doesn't, if they're sick, it doesn't mean any of that. But I do think it's an added tool, and used properly, I think will be very beneficial for folks.